I'm sure.
Now we can begin.
Kind
Kind of like a medical student.
Yeah. Presenting yourself.
Yes.
Talk about a mustard seed.
How are you?
Great. This time I'd like to call the Board of Health meeting to order. Roll call.
Here.
Dr. Hayes,
Here.
Dr. Linderman,
Here.
Mr. Lynn,
Here.
Ms. Reiniger, Ms. Rainey,
Here.
Ms. Vincent.
Thank you. We have a quorum. So the second item on the agenda is the adoption of the agenda. So hopefully everybody's had a chance to review the agenda and get a motion to approve or
I move to adopt the agenda.
Second.
motion and second. Any further discussion? If not, all those in favor, please say aye.
Aye.
Opposed, say nay. All right, motion carries. Thank you. Next item on the agenda is the approval of the minutes from our January 21st, 2026 meeting. Everybody's had a chance to review those and not quick look and comments, questions, or motion on that.
I make a motion to approve the minutes.
Second.
A motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item, board president announcements. I don't have any announcements today. Next item is the health officer's presentation and report.
Thank you very much. We are, just as an update, we are fully staffed at the health department. We have all of our positions are filled and up and running. A couple people are just getting through their training. So part of that process, we've also updated our onboarding process for when people are hired so that it's more consistent across departments. Every department's a little bit different, but it's important that major things get covered and that we have a good timeline. And we feel like we've really been nice and tightened up the process for onboarding. In terms of this January report, the month of January was a little bit slower than a lot of months. That's the way it usually is in the wintertime here. It's not active time for building because it's too cold to build or do install septic systems. But we still did manage to get our program still carried out. As you saw, the care unit saw 21 new clients. The 16 of them we did provide insurance navigation for, which is really important during pregnancy to get those moms signed up for insurance coverage. Environmental health, in terms of the Vector program, it's not an active time January, but believe it or not, we're starting into the active time when they'll be doing larvicidals, and we're revamped our program a little bit that we're concentrating on getting the larvicides out so that we won't have to use so much pesticides later on in the year. And then we're going to probably try and get more pesticides in higher areas of use. So if there's going to be a large gathering, for example, say we have a big outbreak near Notre Dame, a lot of mosquitoes, and we'll spray before those sorts of events. So we're going to be more targeted with our treatment, the prevention and then treatment. The radon program, it looks, we have radon in every library, radon test detectors, not radon, but radon test kits. Excuse my speaking too quickly. And part of the problem we've had with a newer batch of test kits is that they were in a mailer that somehow either didn't survive the US postal system or didn't arrive. They were in envelopes and previously they had been in boxes. And so we're going back to the boxes because we think we've had a few people call and it's like, hey, I never got my test results. And we think that it, was lost in Atlanta somewhere. So basically we're switching back. We saw that there was a drop off and I just wanted, you've probably seen it too. I just wanted to let you know what we were doing about it.
Can I ask you a quick question? Do they still have the same number of people jumping in and grabbing boxes and stuff? And can they drop them off at the health department instead of mail them or no?
No, they have to be mailed. The lab that we contract with is out of Florida.
Okay.
And we had much better numbers when they were in a box, but we didn't put two and two together. but our sleuths here, our team is really good. They called the lab directly and talked to one of the guys that is one of the leads in the lab, and they got the lowdown and they said, hey, you might want to know everybody's having this problem and we think it may be the packaging. So we're just doing boxes now, but I just wanted to let you know that's why it may look like the numbers are down a little bit. In terms of food services, you can see that they are busy always. January is a really busy month for them because they're doing renewal of food permits. And so I personally have had some people asking me, hey, why did you close the Dollar General or the Dollar Tree? And it's not that we necessarily closed the Dollar Tree, it was because of the food didn't get permitted. Is that correct, Karen? And so they didn't get the permits in time. It's not because we're disparaging any particular establishment. They just didn't apply for their permits. And so if they don't get their permits, they don't get to stay that part of their store to be operational. And then our Health First Indiana, the KPIs that you received, they are maybe a little bit disingenuous in terms of only one of there were 8 KPIs displayed, and I hopefully you see them there on page 19. One of the KPIs, only one organization had 8 KPIs. And so that particular organization's KPI was not very high because it was St. Joe. They couldn't hire people to do their program. And so everybody else just really shot the moon. It was really incredible, the KPIs. They were able to get everything carried out and all the programs were very successful. Next month, we will have our official presentation of the HFI report for 2025. So you'll be hearing that. We're inviting our council members and commissioners to come and hear that presentation if they're available. So next month, we will be presenting that to let you know what programming took place and where the money went and how it was spent. Lead continues to be very busy. You can see that the zip codes, traditionally the zip code that's most elevated is 46613, and that remains true. The community outreach setting in terms of the care unit, they're trying to aim for at least 2 events a month with the lead testing. And they didn't get it done in January, partly because of weather and partly because coming off the holidays, but weather was a real, as you all unfortunately remember what January was like weather-wise. And everything else is pretty much the same in terms of numbers. TB numbers remain higher than they've been. Every year we top our numbers with TB. The number of latent TBs, there are 2 types of TB, latent and active. And latent are the people who are sort of in a dormant phase, and we treat them to try and prevent them from becoming active. Does anybody have any questions? I would like to make a couple more comments that I should have made. We are trying to apply for as many grants as possible. And we've been doing a great job. The team has really been very proactive in writing wonderful grants. We actually applied for an American Heart Association grant, and the person from the national level American Heart Association contacted our department saying how wonderful, they had all these people apply for these grants, but how wonderful they really loved the grant that we submitted. And they were hoping to hook us up with the state level American Heart Association and let them know how we're doing this program. And it involves our new chronic disease program that I told you about last meeting, where we're looking at blood pressures, heights, weights, hemoglobin A1Cs, which are tests for prediabetes and diabetes, and lipid panels that we're going to be doing a soft rollout starting this next week. And we're going to be in our libraries, both urban libraries and rural libraries, doing these tests for people who would like to have them done. we're aiming for anybody who wants to access, but uninsured or underinsured, to give them information about where their disease process is right now in terms of any diabetes or cholesterol levels. So it's meant to be informative, but also we're going to educate them and hook them up with resources. We'll have insurance navigators if they need help with that. And we will also have clinic lists available for like sliding scale or people who are uninsured or underinsured, and just trying to get our community healthier. But I thought it was very telling that the American Heart Association loves that program and wants to try and replicate it in other parts of Indy.
Good job.
That's great. Good work. Any questions for Dr. Migliori?
I have one for the KPI. You said St. Joe, the one that's 9.9%.
Yeah.
What happened to that money then?
They
They
did-
did out there?
They did have people that they did have somebody that they hired for a short period of time, and they did do work, but it was just a very brief period of time.
So that all the money that they received though is still just sitting there? Like they
Yeah.
didn't take it and
No, and the way our HFI program is receipt-based reimbursement, so no one gets any money until they give us the receipt and proof of how it was spent, and then we check it out to make sure that it was, legit, and then we reimburse it. So it's a total reimbursement grant. So that money still sits for us to carry out our programming that we're doing, like the radon, the chronic disease conditions, that sort of thing.
Well, the Health First Indiana presentation next month. Will there also be press release? And I'd like to let our state legislature representatives know what good work we did with the money that they told us they wouldn't take away for a while, and they did.
We will make sure that we will advertise it from the highest of mountains.
Any other questions for Dr. Migliori? Our spotlight.
Yes.
You want me to go up front or
What would you like to do,
I
Michaela?
can go up front?
Okay, that'd be great. Thank you. The state loves our lead program, by the way. They like to refer people to us to ask questions or help them troubleshoot their programs. But also we have such a robust and successful program because it's cross departments, it's several units that are involved. We've got nursing involved, we've got environmental involved, we've got public health nurses also help with that in terms of management. And then the CHWs there are boots on the ground. So the CHWs are in a lot of preschools, and it's not because they're going back to school either. They're there to test. Yeah, I can say.
Hi, everyone. My name is Michaela Enright. I'm the lead program coordinator here at the St. Joseph County Health Department. So today I'm going to be talking a little bit about our childhood lead poisoning program. So first, I want to talk about what exactly lead is. So lead is a naturally occurring toxic heavy metal that is naturally found in the Earth's crust. So it's always going to be present here with us in our environment. Lead has been used in many household items, such as in paint in homes that were built before 1978, in gasoline, pipes, cosmetics, pottery, ammunition, batteries, toys, and other items as well. Lead is a neurotoxin, so it causes irreversible damage to the brain and to the nervous system. And it can cause things such as stunted growth and development, speech and hearing problems, and behavioral and learning difficulties. Lead is especially harmful for children ages 6 and under because during this time in their life, their brains are still growing and developing. And also during this time, these children, they tend to exhibit hand-to-mouth behavior. So this can cause them to unintentionally or ingest or inhale lead dust. So looking at lead specifically here in St. Joseph County, it is estimated that about 80% of homes in South Bend have lead in them, and about 70% of homes here in St. Joseph County have lead in them, just because about 80% of homes in South Bend were built before 1978, and about 70% of homes here in St. Joseph County were built before 1978. Lead-based paint here in the US was banned back in 1978. So since we have a lot of homes that were built before then, that is why we have so much lead paint here in our community. Therefore, the most common source of exposure in our county is lead paint and dust in older homes. When people typically think about lead, they think about the water crisis that occurred up in Flint, Michigan about a decade ago. However, what a lot of people don't know is that back in 2016, South Bend actually had 6 times as many children with identified lead poisoning compared to Flint. Fortunately, water really hasn't been a source of exposure here in our county. However, that is not to say we still don't have a lead problem. We find, like I mentioned, we find a lot of lead in our older homes and in the dust and in the paint in those older homes. So that's why it's important for us to continue to address this public health issue.
Is there something, sorry, can I ask a question?
Go ahead, yeah.
Is there something about our community that makes that more of an issue, the lead paint versus like Flint, which I presume is kind of the same age as South Bend?
Yeah, I'm not sure exactly how old Flint is, but just because we have just a lot of residents, obviously, in our county. We're a pretty big county here in Indiana. And because so many of our homes here are older than 1978, that's why we have so much of it here in our environment. But as for Flint, when it was developed and whatnot, that I don't know exactly when it was.
Okay.
But, yeah. So looking at our multi-unit lead structure here at the health department, like Dr. McLeary had mentioned before I began, we have a lot of units that work together on it. We have a very collaborative approach to lead. So we have our nursing unit, our care unit, and our environmental health unit. In our nursing unit, we have our lead coordinator, so my position. So I receive all of the elevated lead results from the Indiana State Department of Health, and then I assign each of those elevated lead cases to either one of our public health nurses or one of our community health workers. And then I follow up with all the healthcare providers to ensure that children who are being tested for lead that are elevated, that they end up being retested for lead and follow up on that. And then our public health nurses, they complete those case investigations for lead results that are confirmed greater than 10. In our care unit, we have our community health workers. They complete the case investigations for lead results that are less than 10. And they also perform a lot of our community outreach, which I'll get into here in a little bit. And then in our environmental health unit, we have our licensed lead risk assessors. They conduct the free lead risk assessments that we offer in these following home environments where children ages 6 and under live or visit frequently, where pregnant women reside, and where a lead poisoned child has already been identified. So here are just a few photos. I know it's kind of hard to see with it being kind of zoomed in, but here are just a few photos of some of our team members out in the community at events that we either host or that we're invited to attend. We provide education to community members that we see at events throughout the county, and also just testing children for lead directly at those events as well.
Who's inside the dinosaur costume?
That must have been Amelia, probably. So here's a summary of our services that we offer. We provide case management services, which is required by Indiana law. So when a child is in case management, this is when we are required to go out to the child's home to do a home visit and a risk assessment. The home visit consists of a nutritional and developmental assessment of the child, which is done by one of our community health workers or public health nurses that's assigned to that child's case. And then our risk assessor will then do a risk assessment of the child's home to see where exactly the lead sources are coming from. And then we provide blood lead testing for children ages 6 and under at our immunization clinic that we have here at the health department. And then we also provide testing at events that we host and are invited to in the community by our community health workers. We also provide, like I mentioned, free risk assessment for homes that were built before 1978, where children age 6 or under live or visit frequently, and where pregnant women live. And then our perinatal and prenatal program coordinator, she has developed a prenatal survey, which I'm sure you guys have heard about before, that she gives to expecting and pregnant mothers in order to detect and eliminate any lead exposures in that mother's home before this baby is born. So it's a preventative way to make sure that the child doesn't even get to the point where they have an elevated lead level. Next, I want to go over some case terminology before I get any further, just so we all have an understanding of some terms that I might be using. So when I say that a child is an unconfirmed case, this means that they have had one capillary finger stick test that resulted in 3.5 or greater. That is considered to be elevated at 3.5. So anything 3.5 or greater, that child is going to be considered elevated with us. When a child is a confirmed case, this means that they have had either 2 capillary finger stick tests that were done less than 12 weeks apart, and those results were greater than or equal to 3.5, or simply just having a venous blood draw in the child's arm that resulted in greater than or equal to 3.5, that is also considered to be a confirmed case. A child is in case monitoring when they have a lead level between 3.5 to 4.9, and then they enter into case management when they're greater than or equal to 5. Like I just talked about, that's when we're required to do the home visit and the risk assessment. So here's a recap of what our team did in 2025. Looking at our cases and our risk assessments that we received in 2025. So we received 175 new case monitoring and unconfirmed cases, along with 32 new cases in case management. So we received a total of 211 new case investigations in 2025. For the risk assessments, we did 41 elevated lead level risk assessments. So that's when that child was in case management. So we had to go do the risk assessment for them because their level was greater than 5. And then we did 62 parent request risk assessments. So that's when the child didn't have a lead level above 5, but the parent or the guardian of the child requested that we do it on their home anyways. So we did 103 risk assessments in total for 2025.
So quick question, when you say that you received the cases, how
Yes.
did you receive it?
So we received those from the state, all lead levels for children that are ages 6 and under. They require to be reported to the state health department. The state health department then sends those over to us based on where the child lives at. So each county will then receive their own lead results from the state. So
So were these kids being tested? Like, so I guess they're, because you said you're getting it from the state.
yes, correct. So they're not directly tested at the state. They're tested at different like doctors' offices, or even we directly test them ourselves at the health department.
Okay.
Because anytime a test gets done, no matter where the test is done at, it's supposed to be reported to the state, and then the state then
Gotcha.
passes that on to us based where the child lives.
Okay.
So when I say new cases that we received, those are cases that were all done throughout the county that the state then reported over to us.
Gotcha.
Yep.
Thank you.
So looking at our lit events and education outreach, I mentioned earlier that our community health workers do all of our community outreach. So we like to keep track of how many events that our CHWs either attend or host throughout the year and how many children they're testing at those events. Events can happen at different types of organizations throughout the year. So they like to go out to daycares, especially here coming up in the spring. They also go to different preschools, health fairs, libraries, things like that, where we get invited to or we decide to host an event at. So this year, for 2025, the CHWs had a pretty big goal of hitting 500 children that they wanted to directly test, and miraculously, they were able to do so. We were able to test 500 children exactly in 2025, which is a great milestone to hit. So kudos to our CHWs because they did such a great job throughout the year, making sure that they're testing every single child that is eligible to get tested. And that was actually over 100 more than we tested in the year previous. In 2024, we tested 377 children. So a pretty big jump from the year prior. So kudos to them. And then I also wanted to touch on a few different events that we had happen throughout 2025. So back in March of last year, we were actually able to get invited to host a table to represent our program at IDUH's Public Health Day. They actually had theirs last week, I believe, this year. But we were invited to talk about our program to different IDUH staff members, to other local health departments, and to state legislators about our program and why it's so important about the work that we do and why we even do it. So that was great recognition to get from the state because like Dr. Bugler mentioned, they're always talking about how good work that we're doing. So they wanted us to talk about our program to other organizations. And then back in May of 2025, we hosted a conference for daycare providers. And to those daycare providers, we presented on childhood lead poisoning and how to decrease lead exposure in their organizations. And then in October of 2025, we hosted 2 testing events during National Lead Poisoning Prevention Week. And we were able at those events to test 22 children directly for lead. And then also in October of 2025, our community health workers, they started a partnership with the Babe Store. For those who don't know what the Babe Store is, it's actually right here in downtown South Bend. It is a store that provides incentives for families and expecting parents with different supplies that they may need for their children. So like diapers, wipes, pack and plays, and other important supplies. They use to get those incentives. They receive coupons from different organizations. So like let's say if a family, they go ahead and they go to their child's doctor's appointment, they may give them a babe coupon so they can go and get different supplies at the babe store. We actually started a partnership with them in order for our CHWs to go directly to the babe store and test children there who do go and visit the babe store. So they are going there every Tuesday and Thursday from 1 p.m. to 4 p.m. We started that back, like I said, in October 2025, and we're looking to continue this partnership here in 2026. They've actually been closed for a couple months because the babe store has actually been doing some renovations. I believe they're slated to open back up here soon. So once they go ahead and open back up, we're going to continue going to the babe store and testing those children over there. Okay. And then another thing we did in 2025, we had our data analyst develop a lead dashboard for us. So this is actually on our website on the lead poisoning page. So if at one point you guys want to go ahead and check it out, feel free. On this dashboard, it contains data that we receive from the state every month. It contains that data is the number of children that we receive that are tested in St. Joseph County. So that dashboard gets updated every time we receive that data from the state every month. And then, like I said, it's a number of children that are getting tested here in St. Joseph County, ages 6 and under. And you can kind of filter it out to see what, like, if you want to look at different like zip codes to see where exactly the number of children are being tested elevated in different zip codes, like Dr. Migliori mentioned 46613 is a big zip code. 46619 is also a big zip code as well that we see a lot of elevated tests come through. And you could actually, I think the data goes back to 2022 to present day. So you can look at different time frames to see when, how many tests were done during a certain time frame. I think you can also look at different test type 2, so capillary versus venous testing. And we decided to get this implemented because we just wanted to provide more transparency about the number of children who are getting tested in our county. And we thought this would be a good way to provide easy access and just to give the public a way to easily visualize it. Okay, and then lastly, looking ahead at what we want to do here in 2026, we have done a conference the past couple years. So our first one was back in 2024 when we did one hosting local healthcare providers and property owners. And then last year, like I mentioned, we did one for daycare providers. We're looking at possibly doing another one this year, except this time we were thinking our audience might be for parents with young children. So we're thinking about that. We're not sure we're going to do that quite yet, but if we do, we'll get into the planning of that as well. And then for National Lead Poisoning Prevention Week this year in 2026, it is from October 25th through the 31st. We plan on doing more testing events again this year because we just had such great success the past couple of years during it. And then, of course, we want to continue our clinical provider outreach. So following up with healthcare providers, talking with them and their staff members about the importance of lead testing, why they should do it, how they should be reporting those lead tests, because every lead test needs to be reported regardless if it's elevated or not. So continuing that outreach with clinical providers in our area, and then continuing those lead testing events with our CHWs because it's so important to get out to the community, get every single child tested who is eligible to get tested. So yeah, that's what we're going to do here in 2026.
So what does testing look like?
So what our CHWs will do, they do the capillary testing. So they don't do the blood draw testing. They do the capillary testing with the finger stick. We use filter papers, but we get those over from LabCorp. So they send those over to us. It's the CHWs will then test the child with a simple finger prick. On the filter paper, there's like 2 different circles that they have to use to fill up the blood from the child's finger on there. So it's a pretty quick and simple process. Once they do that, those then get shipped back off to LabCorp, and then they analyze those, and then they send those tests over to us.
So what's
with
the
the results?
time?
It takes about 5 to 7 business days, I believe. Yeah. So it does take a little bit of time for those results to come in, but we do obviously get all the like parents' information and such to follow up with them afterwards to let them know what the results were and what we believe the next step should be based on those results.
Okay, great. Any other questions for Michaela?
Fortunately, I have. Congratulations on this work and keeping the ball rolling. And this is an issue that has been around for a while. And we were on the board the first time this came through about 10, 15 years ago. And I'm sorry to see that we're still dealing with it. So I have a few questions. Back to the housing market, how many houses could you or would you estimate are still within city of South Bend, St. Joe County, that still might have lead issues, given all the work that's been done previously and all the work that you're doing now
Mhm.
with these fantastic results. Just, we won't hold you to this, but as the expert in the area at the moment, what would you estimate? Are we at the tip of the iceberg or are we down pretty far? Have we mastered this to a degree?
Yeah, I mean, regardless, just because of the age of the homes, I would say there's still probably a pretty good amount. Breezy, I don't know if you would have any.
Yeah, so I would
Expertise on it.
say it would take decades and hundreds of thousands, if not millions of dollars to really eliminate the health hazards that exist with lead-based paint and lead in soil and lead in dust. I think that we do incredible work here. There are other organizations that do really good work in the county, but oftentimes what people have the funds to do are what we call interim controls. So if they do identify lead in their property, they're often going to do something that can minimize the exposure to the lead that exists there, but they don't often have the funds to fully abate the lead that exists. So what would be considered an interim control is if it can minimize exposure for, I want to say it's 6 years. So anything further than that is considered full abatement and very rarely abatement because it's very expensive. So I think there is a lot of heavy lifting and a lot of work that would be ahead of the city and the county to fully eliminate it or to even get 50% of the way there. So I couldn't estimate a number of houses or a percentage of houses, but I think that it would take a long time to fully improve
Right.
our community.
But even people that have a home that was built prior to 1978 don't even know. Like they just don't know if there's any lead in their home. And to be honest, especially if they're trying to sell it, they don't want to know. Because like she was saying, it's expensive to abate it. So
The city, just before we get on to your next question, the city actually has a grant. I don't know if you guys have ever heard of it. It's, I think, the lead hazard reduction grant, I believe. Their fiscal year with their last grant just ended this past year, but I believe they're about to get their new funds. I think they were saying might be next month. I'll have to double check on that. But the city of South Bend has a grant to where if they have a child who has an elevated blood level, actually, I don't even think they have to have an
They don't
elevated
have
level.
to.
They have to just, yeah. They have to have a home that was built before 1978. And with that grant, they are able to use those funds in order for a contractor to come out and actually do abatement on the home. So there are different ways where that work can be done. But like Breezy was mentioning, it would take a lot of money and time and years. And
There was a
that.
time, the University of Notre Dame played a major role in this, helping us deal with this issue. Are they anywhere involved in this process?
Yeah, so they still do those lead screening kits. I don't know if that's what you were thinking about. They still give those kits out. They actually go to the Babe store as well. Like I mentioned, how our CHWs have been going out there. They also go out to the Babe store in order to collect those lead screening kits that they'll give out to families so they can test themselves to see if there's any lead in their home. So they can do, I believe they have a couple of different samples that the parent will collect themselves: paint, water, soil, and dust, I believe. Correct. And then that is merely a screening tool, though. It's not as detailed and thorough as our risk assessment is. So that's what we recommend at the end of the day. But if a parent just wants to, hey, let me just see before I go ahead and do a full risk assessment if the screening kit can detect anything. So Notre Dame still does work in the lead space.
So who else in our community should care about this?
I would hope everyone.
In terms of major organizations
Yeah.
or people who are dealing with the housing market, the Realtors Association, the Home Builders Association. Who else are partners or you can identify? And if not, who else should be concerned about this that presently is not at the table assisting in discussions or more remedies?
Yeah, youth-based organizations, I would hope should play a big part in it, just because obviously they're the ones that deal with the youth and their health every single day. Schools, that's another big one as well. We partner a lot with Head Start, that we will go out and to those Head Start locations and test children directly. They require a lead test in order for children to be enrolled into Head Start. And I know just private daycares themselves, they don't require it. That's something that we would hope could eventually come on, just because when they are requiring that lead test, let's say the child doesn't even have like a primary care provider, a pediatrician, but if they want to go into Head Start or a daycare or whatever, that's a way to make sure that that child is identified. Because if they didn't go through that process and if they don't have a primary care physician or whatever, then we might not even know that they have an elevated blood level. So those types of organizations, and like you mentioned, stuff with like property owners, that's why we did a conference with the property owners a couple of years ago as our first conference, because we wanted to get that information out there. We wanted to let them know that this is a big problem still. Actually, when I first got this job and I told my dad about it, he was like, "That is still a problem?" And I was like, "Yeah, I guess so." So yeah, just trying to educate pretty much any organization out there, especially with ones who deal with children and with homes, because those are the most important.
Where are we with any partnership or potential partnership or assistance by our two major health organizations, Beacon and St. Joe Health? Are they involved in any way, or?
Yeah, they do a lot of testing, especially with their family residency programs. So they do a lot of lead testing in their offices. We've actually have gone out and spoken with both of their residency programs about lead testing and reporting and the importance of it. They were doing it regardless, but yeah, they definitely do play a role in getting those children tested.
Are
over there.
they
And
committing resources and time and money and personnel?
I know that they're testing the children there. But yeah, they are making sure that we're getting those children tested.
Years back, there used to be coalitions when you had an issue like this that affected everyone, that those two organizations stepped up big time equally, because one didn't want to outdo the other, and essentially poured investment capital and resources to help address the issue,
Mhm.
as well as teams of people to do the same. And so if, to our knowledge, they are not doing that.
Not that I'm aware of.
Okay. And so, running here, is there an opportunity for a larger conference politically to address this on a larger level for the county, if we were to bring the right partners together and get more of a fast break push on the issue? Because the issue doesn't, you're making great progress,
Mhm.
but any child that's affected by lead is still our fault. And so we seem to do the work that's required, but my conscience bothers me when we have other people who should care and don't.
Mhm.
And so that's for a later discussion and maybe a separate meeting where we can pick your brain, and we can then as a board take a different approach if we all feel this is a continued large issue in our community.
Yeah.
In marketing and sales, the question is, who cares? And if somebody cares about it, they usually address it, pour all the resources in to take away that urgency of whatever's missing. But if we're not marketing this on a larger basis, then, and you're doing great work, and department has been for some time, but I'm just wondering where everybody else in the community is at the pace we're going. We're not making great progress, but we are making progress. And I'm just wondering if there's a better effort that could be made by the community
Get
at
more
large
involved.
that
Yeah.
could address this quicker and put people not in jeopardy. And that involves the home builders, the renters that, rent dirt cheap places and could care less about the upkeep or maintenance. So we've seen all that before. But thank you very much for your presentation and your time, and I'm sure we'll be talking again. So.
Thank you.
Thank you.
Thank you.
Any other questions, comments?
I would just say my husband's a builder and I also am aware of people that have lots of rental properties in these problem areas. And it is so expensive. And like you said, millions and millions. And I feel like unless you have a political change that occurs where there is a law that says if your house is disgustingly full of lead, you have to tear it down and start over because they just smear the paint on top to cover it and now it's covered until it chips again. That's why it's like a cat chasing its tail. It's never ending. It hasn't changed because we haven't ripped down all those houses in these areas that are disgusting, that are slumlord. And so unless we make them do it, which then you're hitting people's pocketbooks and all the, and that just funnels out like a tornado. So that's where the problem lies.
Right.
I feel like it's the people that care. What are we supposed to do? Because I don't own those houses. I'd say we rip them all down and rebuild them, but we also need to rip the topsoil off because the 46813, that had a factory or something out there, right? That had metal in the soil. So even if we rip the houses down, we still need to rip the soil off, redo it. It's like, it's so much bigger, I feel like, than even our county because it has to do with this. So, yeah.
Yeah, no, I agree. There's a lot that goes into it that would take for all of us, not just us as the health department, a bunch of people and organizations that would need to take part.
So I love that. I know we're chasing our tail, but you're catching it, but it's just, you know,
It's a cycle.
yeah,
Yep.
frustrating. Yeah.
Anything else?
Thank you,
Kayla.
Michaela.
Thank you.
No other questions for Dr. Migliori. I would entertain a motion to approve the health officer's reports for January.
I motion to approve the health officer's reports.
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. All right, on the new business. Item 2621, discussion and vote for job descriptions for various,
I was hoping we could batch those
yes, that would
together.
be great.
So, Mike, maybe I respectfully request that Mike go through them and then batch them together eventually.
Yeah, just want to give us a very high level. I know this has been reviewed by many people. And
Sure can. So the first six are very typical. But number one, I should apologize for hitting you up so hard this month. So we'll not do that again. But for the purposes of this month, the first six are very similar to previous months. So we've approached it where we have tried to do the department level standardization. We drop down to the unit level standardization. And of course, we get into the meat of the individual role and making sure that it's updated to current procedure and the work that's actually being done. So we've kind of covered that in previous meetings. I'm happy to take questions specifically on these. One piece I will mention is yesterday, Ellen did send us a few updates. So what you have in your packet in terms of the actual content has not changed. It's more of details, things like commas, periods, punctuation kinds of things, but it hasn't changed the wording in any significant way from the packets that you have in your hands now. So but I do want to mention because there are those minor changes that were put in on 4 of the 6.
And I just have a quick question. So when it says job requirements, is this what you need them to be able to click off to apply for the job?
Yes.
Okay,
Yes.
only because when I'm looking through some of the job requirements, there's a lot of very specific things about working knowledge of St. Joe County Health Department and like understanding, it's like, how, they don't know that yet, they don't.
Correct. And I was just getting ready to back
Oh,
myself
okay.
up. So where there are things that are needed prior to employment, that will be noted in there that's the requirement. So that may be like a degree or a certain amount of job experience. Other items we will train on the job. So the expectation is that they will be up to speed through our training while they're working with us. So we do have expectations that they will learn those skills.
And so
that
many
knowledge
days or something.
Right, in a
Like,
reasonable-
Go in there or no? Like in the.
In some cases it does, some of it's dependent, like, for example, there are some of our programs we involve the Indiana Department of Health. So those classes happen periodically over the year. So we may have to wait to get someone in there for some people because of the timing of their hiring. They may be able to go next month. Other people may need to go 3 or 4 months down the line. In the meantime, what we will do is we will train them to the best of our ability. And of course, our existing staff should have a good working knowledge of that. So by the time they hit that class and makes it official, they've already got a pretty good knowledge of it. Now they're going to get the fine points.
Is this what applicant wants to go?
Yes.
So only because when I read that, I go, I would think if I'm associate degree in nursing, I'd go, oh, well, I guess I don't qualify because I don't know all that stuff yet. So I feel like there needs to make sure there's clarification in this. Otherwise, you're going to miss a lot of really good candidates who are going to go, oh, I don't know all that stuff about the health department. Just, you know what I'm saying? Make sure it says
Sure.
well trained or whatever.
Yeah, traditionally,
Versus qualified, these are hired.
sure. I will say, we tend to get a very good turnout of candidates for nearly every single position that we post. Sometimes it's almost a little overwhelming, the number of people who we get applying in. But we do go through and we will use that criteria to go through, judge the candidates, and then pull the best ones out for interview. And so we typically have a good turnout. We have very good interviews with folks. We'll tend to do the interviewing at the department level first with the director and assistant director. And then most positions will also be interviewed at the higher level, and that will involve the physicians and myself typically. Sometimes we'll also bring in staff so that their peers will also be a part of the process, so that who they are working with has an opportunity to, is this a good fit for the department? Is this person, do they sound like they have the knowledge? Are they speaking to the truth, so to speak, of the position that we need them to? Do they have the knowledge base? And because we interact with the public constantly, do we feel that they can represent us as a department, both in terms of their knowledge and how they carry themselves with people?
So right now, we're fully staffed, correct? And so all we're doing is just updating all of these job
Right.
descriptions. So if, God forbid, we should ever need it, we're ready to go.
Exactly. There was recognition last year that some of the job descriptions, there was an effort in 2023 that it didn't come to its completion. So some of the roles were updated, some weren't, and some go way back 15 years. And there was a realization that they're just not quite as accurate as they need to be. Roles, responsibilities, unit structure has shifted, but the job descriptions didn't keep up. So this is an effort to just add synergy to all of that.
I think it's great that you guys are doing this, just because I'm doing it myself. So it really does make a difference to have all of this ready to go. But I do agree with what she said, because it says in here, particularly for a job requirement, practical knowledge of standard policies and practices of the St. Joe County Department of Health with ability to apply appropriate procedures accordingly. Well, if that is a requirement to get the job,
We just want people to know what they're getting into. We don't want somebody
okay.
to apply to be a septic installer and they don't even know what a septic system is.
But you could improve it though by saying within 1 year or whatever, like
Yeah.
these are the expectations, but you please apply. We don't expect you to understand the health department because you don't work here.
We'll fix that.
Yeah.
So that we don't,
So,
I understand what you're saying.
Yeah.
No, I think we can fix that quickly.
The last two positions, so these are intern positions. So these are unpaid intern positions. And these are sort of combined with the next agenda item. There may be a little, I think to understand where we're going with the interns, I have to speak a little bit to the next item, so I apologize for that. The Work One group locally approached us and other employers about working with their work experience program. So this is a newer program that they have. It works with folks that are 16, 24 years old. It's a program where these are folks who may not have a lot of job experience or none at all. So they really have not had that experience of working in a workplace, understanding what the expectations and roles and responsibilities are. And they may not really, for some of these folks, they don't have that because, well, for various reasons, but they have struggled to gain that level of experience and are, I guess you could say, trying to find themselves a little bit. As folks go through the Work One program, Work One will help them to find willing employers who will have them enter into, or the potential to enter into, a 10 to 12 week internship program. The WEX program through Work One will pay them a stipend to participate in the program. It is at no cost to the employers who, who participate. They approached us and asked us if there was an opportunity where we could host interns. We would be able to interview and select interns. So just because they have someone on deck does not mean we have to take them on. If we don't feel that they're a good fit or the experience that they're looking for does not fit the skills that we have or the opportunity that we framed, we do not have to take them on. If we do feel it's someone that is a fit for us, then they will go through basically our interview process as it exists for regular employees. So once we've identified that person, Work One will then bring them, assign them to us for that period of time. And then we will bring them on and they'll work in a capacity. So the capacity that we've identified is a scanning it's a scanning role that will allow us to take paper records and digitize them. And so we, of course, we have lots of paper for going back several years. This will help us in freeing up our regular staff so that they can do their normal duties. They will supervise, someone will be assigned to and supervising the student for the area that they're scanning for. So they'll be under constant supervision. And then it will allow us to accomplish a task that sometimes we can struggle to do because there just isn't the time in the day when everyone else's regular work is taking place. So what this will also allow us to do when someone's 10 to 12 week period is finished, Work One will work on if there's another candidate and then come in and then fulfill that role. So potentially we could have a series of students where we can help them gain the work experience that they're looking for, but it also helps us accomplish a task that is frustrating. It's not the best. Most people don't enjoy scanning, but it allows us to get the job done and to improve our department by digitizing records so that we can.
So are these two, Jean, brand new positions?
They are. And the reason where there's two of them is that under the commissioners, anyone, interns 18 and older don't need their approval. Anyone 16 and 17 does.
Gotcha.
So the work rules under the state of Indiana there's no difference. It's just at the local level, at the commissioner level. We just want to be prepared if for some reason when we go in front of the commissioners next and they decide we really don't want 16 or 17-year-olds, we have a job description for the 18 and above that's ready to go and can be readily approved without any modification.
Sounds good.
It's a great program for the youth as well because they're going to have to do a resume. They're going to have to go through an interview process. They're going to have to report to work and be responsible. And at any time, if we look at the resume and we're not interested, we don't ask them to interview. If we interview them and don't think that it's a good fit, they're going to be treated just like any other person applying for a job. And that's part of the learning for them. The other thing they get out of it besides, being paid to do the work is they also now have something they can put on their resume.
Yeah.
So it's a really great program. It's a federally funded program. And then involves a 5-county area in northern Indiana. And when the youth come to them or they come to the youth and they say, I want to see what it's like being a paramedic, then they try and pair them up with, an ambulance service. So I think it's a great program and we certainly would benefit from it too.
Sounds great. So regarding the job descriptions, somebody like to make a motion?
Yeah.
Please.
I move to approve item. Agenda.
Second.
A motion and a second. Any further discussion or clarifications? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Thank you. Next item, 2622, discussion and vote MOU for the work one youth services. You've heard about, right? Any further?
So the memorandum of understanding basically is a foundational contract that we would have with Work One. It wouldn't be for each individual. It would just be our agreement with Work One so that we have, an understanding of how this is going to operate. And then because this is a federal grant, they have to execute a contract between each individual that would take a position so that the federal oversight people can see, where the money's going. They're not just, giving it, somebody's taking a vacation in Hawaii sort of thing.
Right.
So it's a paper trail, but it's also an understanding so that they know that we have this agreement together.
Has legal counsel reviewed that,
Yes.
approved it?
Never operate without our lawyer.
Any other opinions or comments?
Our other legal counsel who's not here today, gotta look at it too. No,
Not legal counsel.
Is
no, wait, no.
He'll tell you.
Legally educated.
paid based on their age or anything, or
It's
just
$20 an hour.
But it's not paid by us.
No,
It's paid by-
no,
No, it's like,
It's paid by the grant.
it's a real plan. Like,
Isn't it?
love that.
And you're helping,
I love it for kids. I hope that the commissioners don't have a problem with 16 to 17. Only because that's in high school and they do the movies
Prime age,
so good.
great opportunity to get
Yes.
ahead.
Figure out if you like it here, kind of thing.
And this is great.
we talked to them about it, so they know.
Yeah. And they'd say yes.
Don't care to make a motion on it.
I will make a motion to approve item 2622.
And I'll second.
Just a second, any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item's on the agenda, grant requests. We have three today. 2623, discussion and vote to apply for auditing the safety program.
Yes, Renata Williams, Director of Care Unit. Previously, I spoke about us applying for grants, just like Dr. McLeary did, that already align with our program. We already have certified car seat techs in our maternal infant health program. Last fall, we applied to the same organization during their National Car Seat Safety Week. They provided car seats for us. We are now asking approval to apply for a car seat inspection station. They require that you have at least 2 certified car seat techs, 1 English, 1 Spanish. We have 2 English, and the Spanish staff that just joined us is already scheduled to do her car seat training in April. This will allow us to do the car seat inspections and provide a car seat to anyone whose car seat does not meet the standards, meaning it's expired or not good, or the child is overweight, and it does not have to come from our pockets. It comes from the grant. So you fill out the sheet for them, submit it to them. We don't have to provide any money. There's no fiscal information, and they provide the car seats to you based on how much you used previously. So if it was 10, they'll give you another 10. And it's a rolling application. They keep accepting new applications up until October 1st. So if you're going to apply, September, August, they may tell you just wait till October. So any questions?
Where is the inspection station?
So you don't have to technically have a station. So right now we already do it with our maternal infant health in our EMBER program and in our home visiting. So they will meet the moms wherever in the community. But we are, side note, talking to the commissioners about potentially having us a spot down here specifically where they can pull up and do that. So yeah.
That'd be amazing.
Excellent.
Yes. Any other questions?
Motion to approve item 2623.
Second.
Motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Item 2624, discussion and vote to apply for Community Health Impact Lab micro grant and the Board of Health Athletic to support this.
Pass these around for me. So last month, when we applied for the American Heart Association regarding the same health screening program, specifically in the rural area, we now have an opportunity to apply for the American Medical Association, who has a $50,000 grant for innovation programs that is physician-led. So Dr. McCord will technically be the PI on this grant, normally I am, for innovative services that are going to be provided in the community. So again, it aligns with the work that we were already doing. They do require that you have a letter of support from a primary partner, which previously I didn't want to announce this, but it is our library, it's our primary partner. We do have some secondary locations too. One Roof is another one. We have our locations are live and ready on our new website, which is the QR code will take you there. So each month you'll be able to see where we're at in the community providing the free health screens and at one location. Right now, we're not advertising them so loud as we're trying to see what the grant will be able to, if we receive a grant, then we can buy more in bulk because we want to kind of slowly roll it out. This will also give us an opportunity to kind of test it out with the community health workers, any tweaks so that when we do receive more people, we're already ready. So we do ask, in addition to applying for the grant, a letter of support from the board to also apply for the grant. That is another requirement. We do have a letter of support from the library, from United Way One Roof, and then from the employer.
So you do these in the library?
They have rooms set up. for
Right.
us.
Yeah, I love that. Love it.
So we should apply, put these all up in our offices yet. Is that what you're saying?
Questions, comments? Otherwise, I'll entertain a motion.
Make a motion to approve item 2624.
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Very much. Item 2625, discussion and vote to apply for Safe Routes to School mini grant.
Hi, Ashley Hellman, Director of Nursing. I don't have a beautiful handout, unfortunately, like Renata, but I'm here today to ask approval to apply for the Safe Routes to School grant. It is a grant through the Indiana Department of Transportation. The grant amounts are between $2,500 and $10,000, and we're going to be asking for about $8,500. We'd like to do a bike rodeo event with children in St. Joe County. They would focus on safety. There would be an obstacle course. We partner with some community partners to look at bikes that come to the event to ensure that they're safe. Some of the money would be to purchase parts for those bikes to make sure everything is tip top. We also are wanting to get safety flags. I don't know if you've seen a little kid on a bike before, but they're hard to see because they're low to the ground. So the safety flags extend up pretty high and they make them much more visible. Another large component of the grant would be helmets. We are hoping to serve 200 children with this event, but thinking that probably about 50% of them may arrive without a helmet. We'd like to be able to provide helmets as well.
What are the ages of these children that you're hoping to reach?
So it's Safe Routes to School, and that is it can be any school age child. So for our event, we are targeting primary school children, but our school liaison, who will be the lead on this event, also has ideas on how to have some options on site for younger children who might arrive, who might not be mobile on a two-wheeler necessarily, but still could learn some bike safety.
So is this like a one-day event that you're hoping to do?
Yes,
And
correct.
in St. Joe County.
Yes, and the current hope is that we would hold this at a Mishawaka school, just because it's kind of central in St. Joe County, and also because the Mishawaka school districts do not provide transportation, and so they have a high percentage of children who do walk, ride, or roll to school, and so we feel like that would be a good location. Of course, it would be open to all children in the county, but
Just an FYI, I don't know if you saw the date was incorrect on here. The term of the grant, you have March 2026 to February 2026. Should be
oh,
2027.
yep, yes, it should, yeah.
Just
Thank
thought that-
you.
that- Yes, I'd share that with you. I did have one other question. Is this just a one-time grant?
It would be, so it is not a renewable grant, but it may be offered again and we could apply again.
Sure.
But it is a grant that has occurred in previous years. And so it may be something we're able to do again, but not something we would count on.
And
What?
you-
Go ahead.
Do you know when you want to do this? Roseanne?
Yes,
Like-
so we'd like to do it in connection with there's 2 dates for Bike to School. And we are hoping to coincide with the October date. There is a May date, but in order for us to get the grant to get our support from community partners and to get everything planned and communicated, we don't think that'll be doable by May. So we think that the October date, doing it in connection with that would be the best.
Oh, why not ask for the full amount?
Because we're not trained to be greedy. No, it's because really our school liaison looked at the items that she wanted to use for the grant. She priced everything out, and that was the amount that she came up with. So
But you guys are very, I love that you're specific, like, this is how much we need and this is what it's for. So I think that's bodes well to us.
Yeah,
for that.
they'll more likely give you the grant.
Yeah.
I also think you guys are doing a great job of finding these extra grants. I know when we talked about the budget cuts, it was like, oh no, there's not much out there, but you guys are coming up with a lot of really good grants. So that's
Yeah.
great.
And I love the flag idea. Be nice if we had color coordinated flags for where they go to school.
oh,
Follow the flag in front of you if it's blue, follow this one if it's red, you know. You see those little kids, they're so little, and you're like, how do they even know where they're going? So.
yes.
Thank you.
Thank you.
Any other questions or comments? Hearing none, I'll entertain a motion.
A motion for item 2625 to approve.
Second.
I have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. All right, on to old business. We have a couple of items there tabled indefinitely. Unless somebody wants to bring those off the table. Stay there. We need kind of motion or action on that.
So what does that mean?
That means we haven't found people to nominate yet.
Oh, so
Nobody else, anybody?
We're
Yeah.
taking
Take
names.
it right off.
gotcha.
Yeah. Next item, public comment. Do you have anybody signed up? Okay. Next item, time and place of our next regular meeting will be March.
We don't know yet.
Oh,
Okay.
Table that.
What do you want me to say about it, then?
You could just say.
It'll be in
there's a
March.
traffic-
It'll be in-
Sometime.
I won't be here on the 18th.
Yeah, it may be
You want to
that
have it then?
if we can't have a quorum on the 18th, we're trying to figure out from you guys if you can make it on the 18th.
I will be in Florida. I will not be making it.
So
I will-
if there's not enough people for a quorum, then we're gonna move it to the following week.
and I think we got everybody for one of the days the following week, didn't we?
The only one I have to check with is Ellen to see if she's here on the 18th. If she's here on the 18th, we can have it on the 18th. If not, it looks like it'll be March 25th.
You're not here on the 18th, right?
Correct.
And I'm not here, so that's 4.
Not the 23rd. Yeah, I won't be here on the 25th, but
You won't be here on the 25th?
You be here on the
If Ellen says yes, I'll have fun.
You be here on the 25th.
I could,
Like,
I should be home by then.
well,
We double check. So
He said it would be on the 20th.
Yeah, I'll definitely be back.
So we won't have quorum on the 18th, it sounds like. Is that
Okay.
correct?
Well, if Ellen can come, we will.
Okay.
Oh, right.
So if Ellen can come,
On the eighteenth, we could have it on the eighteenth. If
I
not,
just
we
need to
can
reach
have
out to Ellen. If she can, then we'll have it on the
It's
18th.
better to have his life benefits.
Yeah, it sure
So
does.
just move it to the 25th, because if we have to have everybody who's gonna be in town show up, and then a sick kid or whatever.
understand.
So,
So the 25th,
no, nobody ever gets sick.
Sounds right.
25th it is.
So our next meeting will be March 25th, 4:30 here downstairs. Do we know yet? No,
It'll be probably
In
downstairs.
this building.
in this building. There you go. Right. In the building on the
Well,
20th.
since this one was supposed to be at the fourth floor, it got moved.
Yes. Right. Our agenda, so we are adjourned.
Thank you.
Thank you.
Oh, no public comment, Sam.
No, there's nobody signed.
This
Fine with me.
on-site wastewater advisory.
I'm not complaining. Myself. I was just,
Never at large.
That's on the news.
I've been on the news. I don't want to. Good.
Resources employee forum.
I think, like, if you technically don't